The chair is pleased to recognize the gentleman from California, Mr. Cárdenas, for your 5 minutes to question.
Thank you very much, Chairwoman Eshoo and Ranking Member Guthrie, for holding this important hearing and giving us an opportunity to go through the details of the fiscal year 23 budget. Secretary Becerra, it's great to see you. I enjoyed serving with you in Congress, and you served our state well and our country, and thank you for continue dedicating your lifelong service to all the people in this great country as our secretary. I want to start today by focusing on an area of increasing urgency, the rollout of the 988 mental health crisis line. As you know, 988 will go live in July of this year, just a few short months from now. This program has the potential to revolutionize the way we respond to our neighbors in crisis, and it'll help us shift away from having law enforcement respond to those people with a mental health crisis moment. I truly believe that 988 will save lives, but it will only be successful if we meaningfully fund the program throughout the continuum of care. Secretary Becerra, I'm curious what the administration's vision for 988 is, and my question is this: at its most effective, how does Health and Human Services see 988 operating, and why is the $697 million that was requested for 988 so necessary in order to see that vision become a reality?
Congressman, great to see you. Please tell everyone back home I say hello when you get there. 988 is indispensable. We have to do it right. We have been dispensing some $300 million so far throughout the country to 50 states, the territories, and tribal governments to make sure that we are ready. Remember, we have a patchwork right now of this lifeline for suicide prevention, but it depends on different phone numbers, different entities to provide the services. This is the effort through 988 to combine it all, to put the glue together to make it work for everyone under the rubric of a 3-digit phone number instead of trying to remember a 10-digit number. That's the first part, making sure that someone, if they decide to seek help instead of go the wrong direction, that they get a voice that can support them right away. But you make a really great point, and that is we have to make sure the services follow through. And that's where we want to work with the states, territories, and tribal governments to make sure that's available as well. It's a locally operated system. We're there to help glue it together. We hope that you'll continue to support that.
Yes, thank you so much, Mr. Secretary, for reminding us that 911 is a localized system, but it's a nationwide system. And same thing with 988, it is a localized system. And I want to first thank you so much for the $300+ million rollout that you're already engaged with already to make sure that we can, as best as possible, hit the ground running when 988 goes live in the middle of July of this year. And also, it's about making sure that when people make that phone call, that there's people linguistically and culturally competent to be able to help those people in the most effective way possible. So with that, can you talk a little bit about what effort is underway to ensure that folks, for example, who speak Spanish and other languages can access this 988 line effectively?
Absolutely, and that's a fabulous question because it doesn't help if you make a call and you can't really communicate well with the person who's trying to help you. We're doing everything we can to encourage localities to have the workforce in place that can provide that service directly. We're also helping establish backup centers, so in case a particular location is getting a lot of calls, that there is another backup center that can take up some of that volume. We don't want someone to call when they're making that decision of whether to do something really drastically bad or get some help when they call that 988 number. We want them not to be put on hold and not to get a busy signal. And so first and foremost, making sure there's someone who can actually provide them with real help. And secondly, as you said, making sure we back them up, but all through that process, it has to be culturally and linguistically sensitive so that we're getting someone who can really help that person that's crying out for some support.
Well, thank you so much. And once again, appreciate your proactive efforts. I want to go on to my question about HRSA, the uninsured program. And there are as many as 30 million uninsured Americans who continue to face unique barriers, especially when it comes to COVID-19 testing and care. And unfortunately, that money has run dry. What is the administration doing to address these needs now that this program has run out of money? and what can Congress do to help?
Congressman, we have requested of Congress further support for COVID activities, including that uninsured fund that providers can seek relief from. And we hope that you're able to work through the process and get us some additional resources.
Thank you. I yield back, Madam Chair, and Mr. Secretary, please say hello to Dr. Your better half, Dr. Carolina Reyes. Thank you.
Gentleman yields back. Just a comment on 988. I think members will recall that all of the contracting from HHS to the states went to the state departments of health, not to OES. And I don't know if that was the best design, but that is the design. And I just fingers crossed that it's going to work the way we all want it to, because it's really going to be an essential service in our country.